So the last disease condition that we'll be looking at under helminths is a disease known as what, the Toxocara, or if you want to call it more properly, say what, Toxocariasis. All right, so Toxocara or Toxocariasis, and you see that this disease is caused by the organism known as what, Toxocara Canis or Toxocara Cati. So the Toxocara Canis is mostly found in dogs, while the Toxocara Cati is found in what, cats. Alright, yeah, this is a very nice image trying to show the life cycle of this organism. Alright, so we'll be talking about this disease condition from the clinical manifestation. We're going to talk about the diagnosis, treatment, prevention, and epidemiology. Alright, so for the definition, so that what, this Toxocara or Toxocariasis, where's my cursor? Toxocara or Toxocariasis is what? It's a parasitic infection caused by the nematode known as what, the Toxocara Canis. That's the one found in dogs. There we have the Toxocara or Cati, the one found in cats. What would be the clinical manifestations? Clinical manifestations is like you talking about the signs and symptoms all together, right, of this disease condition. Alright, so also it will have an effect on the eyes. That's ocular toxocariasis, where it could show up with things like vision loss, eye inflammation, and retinal damage. Okay, then visceral toxocariasis is mainly like affecting your organs. Okay, so the person will be having things like what, fever, cough, abdominal pain, hepatosplenomegaly. That's like your liver and your spleen will be enlarged. All right, then we have the neurotoxocariasis. This one is basically affecting your neurons. That's like central nervous system, peripheral nervous system, right? So to show up with things like what, seizure, headaches, confusion, neurological deficits, all of that could be present. You could see the organism causing that toxocariasis. How can you be able to diagnose this toxocariasis? By doing serology tests, imaging studies, biopsy, and PCR. PCR is what, polymerase chain reaction. Alright, treatment is what, you use antiparasitic medications like what, albendazole, mebendazole, and diethyl carbamazine. Alright, then corticosteroids can also help. Then you can also do a like surgical removal of the cyst. Okay, like physical surgical removal of the cyst. Okay, prevention is just mainly maintain a proper pet hygiene. All right, since this transmission is mostly from the cats and the dogs, just make sure that your pets are dewormed, proper hygienes and all that. Okay, so regular deworming, hand washing, then avoid contaminated soil, food, or water. Epidemiology it has a global distribution. All right, global distribution. It is estimated that about 5 to 20% of humans have been infected with it. It's common in rural areas or areas that are just developing. Okay, so that's it for what, the Toxocara or Toxocariasis caused by Toxocara canis or Cati. All right.